Myasthenia gravis is a debilitating, rare autoimmune neuromuscular disorder that can affect each person differently, so every patient must be treated in an individual way. The Health Innovation Network received funding from biopharmaceutical company UCB that enabled them to deliver a report that uses information from a broad range of stakeholders to better understand the changes needed in rare disease healthcare services and to improve the lives of those living with the disease.
Catherine Dale is the Programme Director of Health Innovation Network, an organisation which received vital funding to conduct a report into myasthenia gravis, a rare neuromuscular condition.
The report was funded by UCB. As a pharma company, they knew that this was an area that wouldn't necessarily get the resources associated that it would need to carry out this piece of work. So they funded the work that it took to bring those people together to build a consensus and identify some areas where the services could be improved.
Catherine and her team have played a key role in creating the report and believes that it can serve as a catalyst for change, not only helping those affected by myasthenia gravis, but also those suffering with other rare diseases.
This report has a number of recommendations, and it's really important because we've gathered these recommendations through consulting with a real range of people who are involved in myasthenia gravis. So we worked with doctors, consultants, GPs, nurse specialists, patients, people with lived experience of myasthenia gravis.
Rare diseases are not common, but 1 in 17, that's 7% of the population, can be affected by one at some point of their lives, which is why reports such as the one conducted here on myasthenia gravis can aim to shed light on what more needs to be done.
And this couldn't be more helpful for people like 66-year-old Cormac Kelly, a patient who was diagnosed with the condition 2 years ago.
I've had myasthenia gravis. In fact, I can remember the very day that things happened. So it was February the 13th, 2021, during the second COVID pandemic, that I was sitting at a table talking on my mobile phone to my daughter when suddenly I felt I couldn't speak. My speech had gone a bit funny, as if I was drunk. So I hung up quickly, and then my wife looking at me said, "You don't look well. You're having a stroke."
After calling 111, Cormac was taken to casualty and diagnosed with a mini stroke, but was transferred to a stroke unit where he received inconclusive results.
I took it upon myself to ring one of my more intelligent friends, recently retired neurologist, who said, "Can you do a video of yourself before and after you're eating and send it to me?" Which I did. Sent it through email. He rang me at 10 o'clock at night time and said, "Look, Cormac, you almost certainly have myasthenia gravis."
After blood test results came back positive from the doctors, Cormac's diagnosis of myasthenia gravis was then officially confirmed.
I understood it was a rare disease, and it was about why me, why did it hit me? Because I knew immediately this is going to affect my life and what I did, my relationships, and more importantly, my work as an orthopaedic surgeon. So, devastating diagnosis at that time.
Patients with myasthenia gravis can often suffer with a range of symptoms, including droopy eyes, slurred speech, muscle weakness, double vision, and problems eating and drinking.
I had very worrying daughters, everybody around me, watching me, waiting for something to happen.
It's a feeling that Dr. Jennifer Spillan understands as a consultant neurologist who has worked with patients with myasthenia gravis and other rare conditions.
Hopefully this report and the actions that will come from it will allow increased or a rapidity of diagnosis, so increase the speed of diagnosis. That came out as a major problem and something that I've encountered day to day clinically, that it takes a long time for patients to get a definite diagnosis. The other thing I hope it'll bring about is increased awareness amongst healthcare professionals, not only neurologists, but A&E doctors, GPs, opticians, different healthcare professionals that people will encounter in the day-to-day environment.
Dr. Jennifer Spillan believes that there are existing support in place for those suffering with the condition that could be further expanded to help patients all over the UK.
So one thing I would hope that would come from this report is the value of myasthenia gravis specialist nurses, and that their number would increase throughout the country.